better understanding of how to use the drugs we have to diagnose and manage blood cancers. Multiple myeloma, amyloidosis are the conditions that I firsthand manage. Better understanding of side effects. I also want to enhance diversity. Everybody should be offered a clinical trial, but we know that patients of minority, the Asian, African American, or Black populations are far underrepresented in clinical trials. So I'm hopeful that we'll have more knowledge of how to use the drugs that we have and enhance diversity of those disparate populations so that everybody can have equal access to good quality of care.